Alright, so before I begin my focus assessment, first thing I'm going to do for my patient is to check the care plan. And upon checking the care plan, I realize that I'm doing a focused abdominal assessment on a patient who just had their appendix removed and they're recovering from that surgery. So after I check the care plan, I'll gather supplies that I'm going to need for the assessment, and then I will wash my hands and enter the patient's room. And upon entering, I will ask the patient, "Hey, sir, my name is Jordan. I'm your primary care nurse today. Could you give me your first and last name and date of birth, please?"
Baron Corley, March 19th, 97.
Okay, and I see that the name matches up with my orders, and so I know I'm in the correct patient's room. So at this point, I will provide privacy and explain to the patient that what I'm going to be doing. I'm going to be doing just checking out your abdomen, doing an assessment on it, seeing how you're recovering from surgery, and shouldn't take more than 10 minutes or so. So I'll explain it, I'll raise the bed to the proper height, and then I will begin the assessment. So, Mr. Corey, I'm going to ask you a few questions. I ask all my patients. Can you tell me who the president is?
Donald Trump.
Okay. Could you tell me where we're at right now?
Murfreesboro.
Okay. And could you tell me about what time of day it is?
It's about noon.
Okay. And then, do you remember why you're here?
I just had my appendix removed.
Okay. So I know my patient is oriented, and after talking to them at the beginning, I also know they're alert, they're focused, their speech is fluent, so I know that their neurological assessment, they're good there. So I'm going to move on to evaluating the patient's pupils. First thing, I'm going to make sure that the pupils are equal, round, and reactive to light, and they are. At this point also, I'm going to just be inspecting the patient's face, making sure there's no lesions on the skin, there's no edema, no erythema or anything. I'm also going to have the patient, will you open up your mouth for me? Okay, I'm going to check all the mucous membranes, make sure there's no signs of thrush or anything like that. If they had a cannula on, I would check the skin underneath it, especially behind the ears, make sure there's no deterioration of the skin. And then after I've done that, I will move on to assessing the patient's arms. So I'll take the patient's arm. I'm going to check the temperature and moisture of the skin. I'm going to check the skin turgor and note that it comes back in less than 2 seconds. I'm going to check cap refill and note that it is appropriate. And then I'm also going to test the strength, so don't let me push up on your arm. Okay, don't let me push down. Okay, I note that he has appropriate strength in his right arm, and so there's no edema or any apparent lesions on it. So now I'll move on to his leg. So here again, I'm just going to be evaluating the skin, making sure there's no edema, erythema, any lesions, checking the temperature. I'll check his pulse, pedal pulse. Note that it is present +2 and regular. And also, when I was evaluating the patient's right arm, I'll go ahead and check his radial pulse here too. Make sure that it is +2. And it is. And so then on the leg, I'll instruct the patient, don't let me push down. Don't let me pull up. Okay, note that the strength is appropriate in his leg. So now I'm going to move on to the left arm. And again, I'm going to check the skin for temperature, texture, moisture, make sure it's appropriately moisturized, look at the skin color, it's appropriate for the patient's race and ethnicity. I'm going to check the turgor again and note that it is appropriate. And then I will also again check the cap refill. And then I'm going to test the strength, so don't let me push up, don't let me push down. Okay, I note that the strength is appropriate and it's equal bilaterally on the arms. And then finally I'm going to check the radial pulse here. Should note that it is present and +2. Then I'll move on to the patient's left leg. I'm going to then evaluate the skin to make sure that the skin is appropriate color. There's no edema, erythema, lesions, nothing like that present. I'm going to check the pedal pulse. Note that it is present, +2. And then I'm going to test the strength, so don't let me pull up. Don't let me push down. Okay, so I note that the strength on both legs are equal bilaterally and appropriate for the patient. So now what I'm going to do is I'm going to move on to listening to the patient's heart. And for this assessment, I'm going to go ahead and just listen at the tricuspid. So the herbs points are because I can hear both S1 and S2 sounds at this point. So, and this is in the third intercostal space, the left third intercostal space. I note that S1 and S2 are both present, and there are no irregular sounds, no thrills or anything that would be concerning. So now I'm actually going to listen to his lungs. I'm going to just listen to the left and the right side, upper and lower regions, just to make sure that there's no adventitious lung sounds and that his lung sounds are clear. I'll just take some deep breaths for me. So I note that the patient's lung sounds are clear. They sound appropriate, and there are no adventitious lung sounds, no wheezing or anything like that. So at this point, I will move on to my focused assessment on the patient's abdomen. So I'll have patients please lay down for me. And what I'm going to do is I'm going to reveal the patient's abdomen, only exposing the parts that are necessary to be exposed. And so first thing I'm going to do is inspect, and I'm going to inspect the surgical wound and make sure that it is healing properly. Everything is still intact. There's no purulent drainage. There's no signs of infection. So I'll inspect that, and I know that the surgical wound is intact. There's no drainage that's concerning. And so then I'm going to ask the patient, what would you say your pain is on a scale of 1 to 10 today?
About a 3.
Okay, 3. And what do you think what's a comfortable goal for you to be at, for you to be able to function?
3 or 4. I would want to get above that.
Okay, so I want to check with my patient on that, and then I want to how have your bowel movements, or have you had any issues voiding today? Have you urinated?
Yes, I have. No issues.
Okay, no issues. And then when was your last bowel movement?
Last night.
Last night? Okay. So now I'm going to go ahead and I'm going to auscultate and listen to make sure that the bowel sounds are normal active. So I'm going to start in that lower right corner quadrant. I'm going to note that the patient's bowel sounds are normal active. They were present in all 4 quadrants. And yeah, that should complete my assessment of the patient's abdomen. And so now I'll move on to the posterior assessment. So lower your shirt, turn around for me. So for the posterior assessment, first thing I'm going to do, I'm going to assess the patient's skin and note that there's no edema, erythema, no lesions, nothing of concern. And then I'm going to go ahead and listen to the lung sounds. Take a deep breath for me. So I note that the lung sounds, again, are appropriate. There are no adventitious lung sounds, no rales or bronchi, nothing that would be concerning to me. So that will complete the focused assessment. And so at this point, I would lower my patient's bed back down to the lowest locking height. I would assess them once again, make sure that there's nothing else they need from me. I'll make sure their call light is within reach. And then I will tell them when I expect to return. And at this point, when I'm leaving the room, I would dispose of any PPE. I probably would have had gloves on for this assessment. I would dispose of the PPE, clean any of the equipment that I used, and then immediately document the assessment.